Okay, we're diving straight into a situation where every second counts. A high-stakes medical emergency where the very first choice you make could literally be the difference between life and death.
All right, picture this. You've just arrived on the scene. The call came in for an elderly man who's, well, he's just not acting right. You step inside and there he is, agitated, totally confused. His daughter's there, she's beside herself with worry. And you're the first responder. So what's your absolute first move? What's the #1 priority here?
So you try to start your assessment, right? But things go south fast. This isn't just confusion anymore. He's actively fighting you on this. He looks you dead in the eye and says, "You are not taking me anywhere." And all the while, you can feel that clock ticking.
Okay, this is it. You're at a crossroads. You've got to make a call right now. There are a few different ways this could go, but only one of them is the right one. Let's break down the choices you've got. What's your move going to be?
All right, first up, we've got option A. You could gently restrain them. I mean, the goal is to get him to a hospital, right? Where he can get the help he needs. And this seems like the most straightforward way to get that done.
Then you've got option B. This one's a totally different approach. Instead of force, you're using your words. You try to calm him down, talk to him, maybe build a tiny bit of trust. And while you're doing that, you try to get a simple but absolutely critical test done, a blood glucose reading.
Now for option C. This one brings medication into the picture. You could give him a shot of diazepam. It's a sedative to calm him down. And look, this would for sure make getting him to the hospital easier and probably safer for everybody involved. It kind of seems like a pretty logical way to handle his agitation, doesn't it?
And last but not least, option D. Here, you jump straight to a pretty common treatment. You start an IV and push dextrose. That's a form of sugar. The thinking is, if this is all because of low blood sugar, this would fix the problem almost instantly. A quick, decisive action. So there you have it. A, B, C, or D. Which one is it going to be? Well, the correct protocol, the one that puts the patient's safety above everything else, is option B. But here's the thing. Just knowing the answer isn't enough. We really need to understand why it's the only right choice here. You see, the right way to handle this is actually a 3-step process, and it all starts with how you carry yourself. You've got to approach with calm, try to talk him down verbally, and then, and this is the most important part, you prioritize checking what's wrong over just doing something. You have to check that blood sugar level.
And to really hammer home why B is the only way to go, we need to look at why the other options, A, C, and D, are so dangerously wrong. Every single one of them is built on an assumption. And in this line of work, assumptions can literally get someone killed.
Just think about the risks for a second. If you jump straight to giving dextrose and he's actually having a brain bleed, you could make it so much worse. If you just assume it's a psychiatric problem or you sedate him, you're basically putting a mask over a life-threatening medical emergency. See the pattern? In every single one of those wrong choices, you're just treating a symptom, you're not finding the actual cause.
I want you to really let this next part sink in. The protocol says the assumption of a psychiatric crisis is not in the best interest of the patient. That's it. That's the core lesson right there. When someone's mind is clearly not right, you just can't jump to the conclusion that the problem started in their mind.
And that brings us to the crucial point here, what we'll call the golden rule for any patient who has an altered mental status. And that rule is you always rule out a medical problem first. It's such a simple principle, but it's one that absolutely saves lives.
So, what exactly are we even talking about with altered mental status? Well, AMS, for short, is really just any sudden change in how a person's brain is working. And one of the most common and, importantly, most fixable causes is hypoglycemia. That's just a fancy term for critically low blood sugar. And get this, low blood sugar can look exactly like a psychiatric emergency or some other scary brain problem. But the great news is, it's super easy to test for and to treat.
Okay, so let's boil this all down to the key takeaways. When you're dealing with altered mental status, the mantra is medical first, always. Remember, hypoglycemia, low blood sugar, is a really common culprit that you gotta check for. Your most powerful tools in that moment aren't restraints or sedatives, they're your calm voice and a simple glucose meter. And never, ever forget, what looks like a behavioral issue on the surface could actually be a massive medical emergency hiding in plain sight.
And all this really brings us to one final big question. In a crisis, when the pressure is on, our gut instinct is to just do something, right? To act fast and treat what we see. But what this whole scenario shows us is that sometimes the most important step isn't an action at all. It's a question.
So the real challenge is, can we train ourselves to fight that urge to jump to conclusions? To just take a breath and assess? Because in these situations, asking the right question is always, always better than having the fastest answer.